and welcome everybody. My name is Sophie Chester-Glynn and I'm director at Coproduce Care. And I'm delighted today to have two fantastic guests with us on our Coproduce Care Chat, if I can say it, which is Oona Smith and Martin Green. And safe to say that I'm really looking forward to a fantastic debate tonight about all things COVID-19 care, what's happened in the past, what's happening in the future. Loads of topics to get through tonight. We're going to whiz through as much as we can in the time that we can. It's lovely to be joined by you, but as ever, we have the dream team on tonight. When did you think you'd see a live stream with Martin Green and Oona Smith, both sharing the same platform on an evening, and you don't even have to leave your house and go to a conference for it? So please do share with your colleagues, share on your WhatsApp groups if there are any, or on your Facebook groups that we have gone live. There'll be an opportunity to chat and ask questions directly to them. So use that opportunity because you may never get that again. These are very extremely busy people, and we're really lucky to have them on. So please do share as much as you can, whether you're watching on Facebook or you're watching on YouTube, or you've just scrolled on to us because we're also streaming on our Twitter page as well. If you've got questions, then go to the chat for care on use that as a hashtag on Twitter. But of course, if you're in this live stream anyway, then comment. Get that comments box flowing with as many ideas, many thoughts on anything that they have to say. And let's connect and have a vibrant conversation. So share, comment, and Co-Produce Care, for anyone who doesn't know, we're a non-profit organisation. We started the end of last year, and the whole point was to open up the care debates, social care in particular. It was a particular passion of mine. I work in social care as a care provider, that we didn't have much of a voice. It was very much health centered. And of course, COVID-19 happened, and that played out right before our eyes with some ridiculous consequences. So, we are just keeping things going. We've always wanted to encourage people to get involved with changing policy and law. So at the moment, we've got things together to help people to respond to the Health and Social Care Select Committee's inquiry on workforce within social care. The deadline is tomorrow. We're hustling. One of my colleagues is still writing up the report tonight. So, that's the kind of stuff that we do and we want to carry on doing. And thank you to anyone who participated in our questionnaire. We did a questionnaire because we wanted the voices of care workers and registered managers to feed into that inquiry. We put out a questionnaire just a week ago and we got nearly 400 responses from you. So thank you. This is what we're all about, is getting those unheard voices who are absolutely doing the work every day, night and second that we're breathing, but often don't get listened to by policy. So do engage with us. If you want to know what we're doing more, then your social medias, we're on every single platform. But this COVID-19 period, we are doing live streams to get the health and social care debate out there to people. So it's not just snippets on the news, 10 minutes, 5 minutes, it's hour-long conversations once or twice a week. But engage with us, subscribe to our YouTube channel. If you are watching on YouTube, click the subscribe button, click the bell so you'll know when we go live with everything. And the same thing with Facebook. I believe you just follow our page and you'll get updates. So I don't want to waste any more time because it's not really for me to be babbling on. We want to get our guests on. We're going to introduce Martin Green. He's from Care England. He's the CEO of Care England. You will have seen Martin Green around. Care England represents care organisations, specifically around care homes as well. They do a huge amount of lobbying, representing some of the issues that are in social care that often, again, don't get heard about. Very passionate speaker, and it is great to have him on the show today. So if you don't know Care England, that's their logo. So I will welcome Martin into our live stream. Hello, Martin.
Hello, Sophie, and thank you very much for asking me to come to the live stream, and thank you to Coproduce for all the work that you're doing, and particularly the work you're doing to ensure that the voices of people who are delivering care are heard in this debate. And I'm really looking forward to this evening, because it'll be a real opportunity for me to talk about some of the things that I think, but also to hear from a really diverse group of people who are looking into this live stream what their issues are, so that I'll be much better informed at the end of this. So I really appreciate the fact that you invited me.
Thank you so much. So I probably should allow you for a couple of seconds just to introduce Care England, if there's anything I missed out, and some of the things that you've been doing to support the sector during COVID-19.
Yeah, thank you, Sophie. As you said, Care England is a representative body for care providers. And one of the things that people don't sometimes understand is that we represent a very diverse group of providers. So we do have all the large corporates in membership, but we also have a lot of large charitable organisations, some smaller organisations as well. We represent predominantly residential care in the field of older people's care. We also have quite significant numbers of people who deliver care and services for people with learning disabilities. And also we have some brain injury units and some mental health units. So I think our work really encompasses the whole of the social care sector. I should also say we do have some domiciliary care services and some live-in care services. So we are seeing how the issues around social care really affect people. And it's an opportunity, I think, for us to put forward some of the issues for social care. Now, I think in this pandemic, what we've tried to do is represent the sector to government. And I think I want to mention this in the context of how things started and how things have started to change, but also how I think we need to see some significantly greater change in how the system has responded to COVID-19. Now, if you'll remember, at the start of this pandemic, the focus was very much on the NHS, and the strapline was stay at home, protect the NHS, save lives. I think what that didn't do was recognise that some of the people who were in most need and some of the people who were most susceptible to this virus were older people in care settings. And what I think we missed in the start of this was that care settings were communities of people at most risk. What this did was translate a lot of policy into a point where they pretty much ignored social care at the start of this pandemic. So, for example, one of our big issues was how to access PPE. Now, partly it was an issue because we had our supply chains completely disrupted because everything was being sent to the NHS. So I think a really big learning point out of that was that if we have something like this again, the important thing is to first of all identify where people are who are at most risk. And if that's in social care, then social care has to be a priority. We should not disrupt the existing support networks to social care, whether it's PPE or any of those sorts of things. And we should focus our attention on the citizens, not the organisations. And I think one of the things that's come out of this pandemic is that we need to re-look at a sort of blanket approach that was developed, which said the NHS first and other things second. Well, it should have been citizens at most risk first, wherever they might be. And that was the thing that we picked up on as an organisation and have lobbied hard to try and change. We've also had issues around the testing regime. Now, at the start of this pandemic, our focus on testing was making sure that people were not leaving hospital and going into a care home without a COVID-19 test. Now, sadly, that happened on a lot of occasions. So what that may have led to is COVID-19 entering a care setting. And if you imagine that people at most risk are in those care settings as somebody who is diagnosed later as having COVID-19, but was not tested at the point of discharge, goes into those settings, that can have a serious implication. So I think one of the things we've got to do around testing is make sure that the testing regime, first of all, make sure we know exactly who's COVID-19 before they're moved around the system. The next issue on testing was that we have to have regular testing for care workers and regular testing for residents in care homes. Testing is not a one-time occupation. And I think my concern is that at the moment, the whole policy agenda seems to be about getting people tested. Well, we are not ever going to reach the end of that until we have a vaccine. So we've got to have a really clear policy around testing people very regularly, both staff and also residents. The other issue about testing is that as we move towards trying to reinstate some kind of connection between families and people in care services, we also want testing for families so that they will know what their COVID-19 status is before they go in to talk to their loved ones. And I think one of the big challenges and tragedies of this pandemic has been the way in which people have not been able to be in contact with the people they love, particularly people at the end of their life. And that will be an emotional scar that will never really heal. So I think one of the things that we've got to do is recognize that testing is one of the foundations of re-establishing contact between care home residents and also their families. We've also had some really big issues around staffing. When we had this pandemic, we had a lot of staff who had to self-isolate in line with the government's policy. And what we've had to do is we've had to work out how we can make sure that we have enough staff so that these services can still run in a safe and effective manner. And what that's done, of course, is put enormous pressures on the members of staff who are still in their services. And it's also led to a lot of concern for members of staff who've had to self-isolate, who don't want to be away from their services at a time of crisis. And I think Oona, I'm sure, will talk a lot about this. But one of the things I really want to say is one of the things this pandemic has really showed is the absolute professionalism and commitment of the social care workforce. They have been beyond amazing. And when you see what they have done in order to support the people that they are caring for, it has been truly humbling. And I think as we move out of this pandemic, we have got to look at the remuneration, the training competencies frameworks, and we've got to re-establish social care as an absolute profession. It always was. People have recognized that in this pandemic, and we must not let them slip back and put social care workers in a category which is about them being seen just as workers. They are consummate professionals, and they've proved it. And so that's some of the lobbying that we're doing on that front as well. I think there have been some very big issues about the interface between the NHS and social care. What this pandemic has shown is these are two interdependent systems. They cannot be separated. And one of the really sad things has been the government has put enormous amounts of money into the NHS. It has said, in effect, there is a bottomless pit of money. It has given actually huge amounts of money to social care, 4 billion in about 15 weeks. But it's given it through local authorities, and this has meant it has not reached the front line. So we have got to start reminding ourselves that money allocated must be in the front line of care, and it must be delivered immediately to care providers. They need it so that they can buy PPE. They need it so that they can support their staff. They need it to take count of extra costs around staffing. They need it to ensure their long-term survival, because, of course, one of the tragedies is that occupancy levels have significantly dropped at a time when expenditure has increased. And this is causing a major challenge for the care sector. And we have
Yes,
Sorry.
I love the fact that you brought up funding, because there's a few current things that are happening at the moment. One of the things that was announced was this tranche of £600 million, which the government announced. And it's a fantastic headline to say, look what we're giving care homes and care organisations. We're giving them all this money. It's a lot of focus on getting it to the front line. Fantastic. All sounds good. And then you have I'll just bring up some screenshots here. So this is what the purpose of the grant was, that £600, to tackle, I've highlighted, the risk of COVID-19 infections. It's specific infection prevention control. Fine. Now, I noticed on some of the groups, since it's been filtering to providers, and you'll know about this, and I really want to hear your thoughts on this, is that there are quite a few limits on what we can use the money for. So providers were thinking, just as you've mentioned, PPE, fantastic. If you look at a draft contract that is available for people to see on a network, it's things like guidance. So talk about paying staff who are sick with COVID. Okay, fair enough. And they're talking about limiting it to staff, in terms of segregation and helping with that. In terms of recruitment, fine. And then to help limit the use of public transport by members of staff so that we can provide basically private vehicles. I mean, what's been going on in the chats that I'm involved in is that's not exactly what we need. And those restrictions are too tight. Are you hearing the same from your members at Care England?
Yes, we are. And one of the things that is a real scandal, I think, is first of all, that they have tied this in knots. And secondly, that they've put it through local authorities. I want to know where the 3.2 billion that went into local authorities before the 600 million was announced has gone. Because that money was supposed to be about supporting care at the front line. Well, people weren't getting that. And there are lots of authorities. I mean, people like North Tyneside who were giving derisory figures of 5% increases, or expecting people to go through 1,000,001 administrative hoops to get the money. Don't these people realise that one of the problems in you running an organisation is cash flow? Well, of course, they don't realise it because they don't have to deal with it. But if you're in the real world, whether you're a charity, a business, you have to deal with cash flow. And if, for example, in one case I know, a care provider who usually spends at this time 200,000 on the PPE, they've just signed off 2.7 million pounds worth on PPE. Now that has to be paid for. So I think all this ridiculous nonsense of tying it up, giving it to local authorities. When will the government get it into its head that local authorities are a failed mechanism? And I was told by a minister that it was very difficult to give money directly to care providers. My response was, with a 70-seat majority, and when you can easily put through legislation to limit the liability on the NHS, or indeed to limit the Care Act responsibilities of local authorities, if you can get that through Parliament, why can't you get something that says we're going to put the money directly in the hands of the provider? And unless they do that, however many billions they announce, it won't have any impact because it won't get to where it should be.
Yeah, absolutely. And I love your honesty on these subjects. I just also want to bring up something you talked about, ministers, because obviously they're the ones in power. And what do you think about this? Is something that's been shared a lot as well. The lack of awareness of what's going on in social care by ministers. So this is a clip from Sky about what was going on in care homes that was out just over, I think, a couple of weeks ago now.
Do you accept then that in the interim, you told care homes, some of them, that said, we are not going to take these patients, we will stop your funding if you do not? Do you accept that that happened, or are you saying that they are misremembering?
I am not aware of NHS England giving that instruction to any care homes. You first mentioned it to me now. It's certainly something I'll look at.
OK.
So this is something that he wasn't aware of. There's a lack of understanding. Do you find that frustrating? Because you do have a lot of contact with them. I know that you're doing lobbying. Do you find that frustrating? And is that going to risk us having a second wave?
Well, I think what I want to say is I want to pay great tribute to Helen Whately, who's the Minister for Social Care, and she has worked incredibly tenaciously to put the issues of social care on the agenda. And I think what that clip really showed was that the silo thinking and the silo working that exists in the current system is also evidence in the ministerial team. What we need are ministers who understand each other's portfolios. But I have to say, I will make a very very, very clear statement about Helen Whately, who has really been, I think, an exceptional minister at the most difficult of times. And one of the great things about Helen Whately is that she is very easy to engage with, and I do think she has a good understanding. I think the challenge now is to get that understanding transferred right across government. But I would also say that one of the challenges for any government minister is that sometimes the system around you, which is supposed to be delivering what you want, is not competent or able to deliver. So ministerial announcements don't necessarily deliver their outcomes. And partly it's about the systems around them and the organisations, some of whom have shown themselves not to be of a culture that can make instant decisions. And I do think when this pandemic is over, we're going to have to take a long, hard look at some of these quangos and see whether or not they have the right capacity, the right competence, but also the right culture at a time of crisis.
Yeah. Thank you for that. Sorry, it takes me a bit of a delay getting back into the stream. So that's really helpful. Thank you for those views. And I wanted to move on now, because we are squeezing a lot in. Each thing that you're saying, we could spend a whole live stream on each section, to be honest. But there's a report from CQC, and I know that I'm part of a provider group, weekly meeting for Care England, because the care organisation I work for, we're members of Care England, and we talk about learning disability services. And it's something that I actually talked to Helen Whately about when she came on a live stream with us a few weeks ago. And I was said, no, I'm very concerned that learning disabilities could be, when we hope not, the next care home statistics, because is there enough attention being paid? And these are some of the statistics from CQC, and they're looking at people. Sorry, I didn't say if I supported living, actually, with the LDN, if I misspoke slightly there. But yes, with learning disabilities and autism, and they are showing just that there is a huge spike in what you would expect right now. What's your views on that? Do you feel like the government is looking to address those issues? Because I know that from the provider forums that I'm involved with, people are saying a lot of attention on care homes, very little support for those community services where people with learning disabilities do reside.
Yeah, and I think you're right. And I think, again, this was another example of, at the start of this pandemic, people with learning disabilities were not very well considered. And I think the care homes caught up when the data showed that there was a major problem in care homes. And I think now that the data is similarly showing that people with learning disabilities are also having a lot of challenge around COVID, and sadly, some of them are dying, then that has made people realise that they need to be focusing on the people. And actually, one of the things that I want to say as well, I'm not concerned whether people are living in a supported housing context, a residential care context, or indeed whether they're being supported in their own home. It is the person we should focus on. And if people have a learning disability, that may make them more susceptible to COVID. So they should be in a priority group to be supported, just as anybody in a care home would be. And I think, again, we're starting to see data now which is showing that people with learning disabilities are disproportionately affected. And so the system is running to catch up with that data and trying now to put some new measures in place that will support people with learning disabilities. And I understand that we're going to see the testing regime extended to learning disability services shortly.
That is really good news, because I know that's a frustration for so many people, the testing, and obviously still needs to be a lot of work done even in testing in care homes. But just to know that that's the whole system, it's like almost been a baptism of fire for understanding the whole social care system and being forced to understanding it, and also being highlighted, to ministers, to even Public Health England. Sometimes they just don't understand how we function. They are, and which is really worrying, because their guidance then doesn't reflect the reality of care. So there's a huge amounts of issues. And I just want to kudos to Newsnight last night. They pretty much spent the whole of their program on care homes, which was really, really, really good. One clip, they talked about an experience of a care home. This was just before, I think this was a couple of months ago, and these were some of the stats that they were going through. So I'll just play a very short clip of that.
But as of today, the charity's toll has been heavy. They've lost 398 residents in their care homes to either confirmed or suspected COVID-19. 3 staff members have also died, and 90% of their homes have had confirmed or suspected cases.
How worried are you of a second wave? Are there any things that we are doing right now that we need to stop doing to prevent them, do you think?
Well, I am concerned about a second wave, and I think one of the problems will be that as there is a bit of a relaxation in general society, we may see a bit of a spike in infections, and of course that will then have an implication for care homes. I'm also worried because the second spike would then lead us to have to re-examine whether or not we might be able to engage relatives with the people who live in care, etc. And I really want us to get to the point where we can do that as soon as possible. But if there is a second wave, we're going to find that a lot of those things might have to be reintroduced. But I hope that we have learned a lot from the first wave. And if there is a second wave, we'll be much clearer about how we need to support care services in ways that will be tangible and stop the infection really getting hold within care services. And some of that is going to have to be about the way in which support organisations like the NHS, like a range of other bodies, are going to have to change what they do in order to be supportive of the care sector and to make sure that a second wave doesn't have the devastating impact that the first wave has had.
Yeah, absolutely. And it is scary times, and we just want to be listened to. And I do appreciate all the things that Care England is doing it to represent members' views and ideas and everything else. And long may that continue. Anything positive? Anything that we can smile about?
Yeah. Well, there are lots of things that are positive about this. And one of the things I'm going to do is I'm going to identify all the things that have changed that we have been able to see rapidly introduced, and we must make sure they don't slip back. So, for example, the enhanced healthcare in care homes. For years, care homes had real problems about access to primary care, and what we've seen is a really swift response to that. We've seen some brilliant use of technology, and I think we have now seen that we can engage much more in the technological age, and that's going to be better in terms of the outcomes to residents and also more efficient for the providers. You know, there used to be so many hoops to jump through to get on things like NHS Mail, and some of those were now swept away. Also, do you remember, I'm sure people do, how many months it used to take of arguments when it was all about winter pressures and we could not get people out of hospital? Well, when there's a need to empty beds, there are processes that can really get people out of hospital very quickly. And when things are back to normal, we must not let those things slip away. There is also a lot which is relating to the workforce. So the workforce has really proven itself to be a highly skilled, very professional workforce. And so we will now do things that we were told, oh no, you couldn't possibly do that because the NHS had to do it. Well, when the NHS went into retreat when COVID-19 started, our colleagues went into attack and stepped up and delivered a lot of those services. So in the future, I will expect that some of that money that was used to be used for the institution and organisation will now flow into social care, and it will be an opportunity to enhance the reward packages as well as the training, development and skills acceptance of our staff, who have been fantastic in this pandemic.
Thank you. And that's a lovely area, I think, to end on a high note, and a fantastic segue to go on to workforce. And of course, the ones who are really looking at workforce are Skills for Care. So thank you very much, Martin. I will just say that there haven't been so many questions as stuff, but I have been highlighting some of the comments that people have been putting on the chat there, and it has been quite busy. So people are listening and they are enjoying what's being said. So thank you very much for coming on this evening, and we will let you go. So thank you so much, Martin Green.
Thank you, Sophie. Thank you, everybody.
So that was Martin Green, CEO at Care England. Very grateful to have him on. That was fantastic. While we'll just take a couple of seconds before we introduce Oona on, it's just a quick reminder that we don't ask for anything. We're doing these chats pretty much every week. They do take some prep, and all we want is for people to just click on the subscribe button if you're watching on YouTube, and if you're watching via Facebook, then please just click on the like our page. Sorry, I'm not very good at social media. Do something, click on something somewhere and just support us, because the more you do that, the more that people will see it, and the more that people can engage in these really frank and honest discussions. And that's the kind of stuff that we want to do, not just the headline stuff, but digging in beneath the headlines about what we're all going through. So and if of course you're just joining us now, then share if you're in groups that would enjoy this. I know lots of people have questions for Skills for Care, so this is the time to ask the head CEO of Skills for Care. So without further ado, I will introduce Oona Smith into our live stream. Hello, Oona. Good evening.
Hi.
How are you?
Hi, Sophie. Thank you for inviting me. I'm good. Martin took all my points, so I hope I have something to say. I really enjoy watching the show. I think you've had some great advocates for the sector on. So yeah, really pleased to be here.
Great. And I'm really excited to have you on, especially because you're actually quite new to the job, and some people might not know you've actually had trouble with the virus yourself.
Yeah, so I started in Skills for Care on the 9th of March and then got COVID-19 on the 13th, so the Friday, and was quite sick for a little while, but it was quite early on, and so there was still that narrative around if you're young and you're healthy, don't worry, and I think I've been more worried now, but I only had 5 days in the office before then we closed down the office, so I've started and having to work quite quickly remotely, which brings its own challenges in terms of just trying to connect to people and really understand. So I'm just taking every opportunity to connect with as many people as possible, and also saying I just need people to be really honest with me, because there'll be stuff that I just don't know. But I just think everybody's been so supportive, and we've got a great team in Skills for Care, but also people in the sector. I think it's a time that we need to join together. I think, and we couldn't need it more, and we couldn't need to focus on workforce and value in the workforce more. So I feel privileged, I suppose, to be in the role.
Yeah, thank you for that. And it's good to hear a little bit about, your experiences, and that you really want people to engage. So you hear that, people, if you've got ideas, thoughts, comments about what Oona is saying, or things about engaging with Skills for Care and some of the things that they're doing. So I'd love to talk a little bit about some of what you are doing. And I have got some things to bring up. I won't preempt what you're going to talk about, but I might flash them up, some screenshots from the website. So probably, most people on this call listening to this, will know who Skills for Care are, but maybe in a sentence or two, you could just tell people, who you are and what you do. Yeah.
So we're a charity. We've been in existence for about 20 years, and we operate in England only, so not across the UK. And we're basically the skills and workforce body for social care. We work a lot in partnership with a lot of the people that you've had on your show, really good advocates, Martin Green and Vic Rayner, Sky, CQC. We work right across the sector, and what we try to do is, I suppose, three main chunks of work. One is around direct support. So we provide direct support and guidance and skills development and frameworks. and we do that for a range of people. We do a lot of support for registered managers, which I might talk about later in terms of the particular support around COVID-19. And then one of the other things that you probably have seen from us is our intelligence and our insights, and that falls into two areas: our more quantitative information, so our stats and our data through our adult social care workforce data set, and that has about 54% coverage of the sector and gives a really deep understanding, I think, of where people are, in what settings they work. And then we have our market intelligence, which is more qualitative, and that comes from our local teams who are really connected with what's happening locally. And we join those things together to then influence and to work with Department of Health and Social Care. We're a strategic partner of Department of Health and Social Care around solutions and around issues that are coming up. And then I think the third thing that we do is around that, and Martin said it really well, that real value and recognition, and I suppose the ambassadorial role for the social care sector, and just reminding people, if they don't know it, that these are really skilled roles, and that we might get on to this later, but I think we need to I suppose bang the drum for social care. And you know what we hear all the time around integration of health and social care, and I'm a real believer that the experience for the individual has to be integrated, but we can't lose what is good and what is valuable in and of itself around social care. And I think we have a real role in banging that drum, but also in helping people to understand what social care is and the diversity of social care. So we cover all of the sectors, so not any particular a setting, or so the whole sector, including personal assistants and individual employers, care homes, dom care, and so we speak to the whole sector and try and understand what's going on, particularly around workforce and skills.
Phew, I said a couple of sentences.
I'm so sorry. I took my lead from Martin.
No, it's good. And you are doing a lot. So now I just want to move on. We have got lovely discussions, and we will come on to those to keep them flowing. I'm making a note of what people are saying. Just to give it some context, COVID-19 now, what are the things that you have brought in specifically to help the sector or to help registered managers? Because I think that's a big focus for Skills for Care. Could you kind of talk through some of the things that you've been doing as a response?
Yeah. So I think our first two areas of focus, the first was around recruitment, and getting what we were hearing and expecting was we're going to struggle. We already have 122,000 vacancies in social care at any one time, and so any increase in that is difficult. And so we worked quite quickly to get training developed, so rapid induction training, to get new people into the sector and trained and working, but also refocused all of our resources and guidance to support people to recruit virtually and recruit in the COVID context. And then as well as that, our priority was definitely around registered managers as well. We've got a registered manager network, and we opened that up so that it was free for anybody to join. And the membership of our Facebook group rose, I think, about 190%. So there was definitely a need there, and we provide direct one-to-one support for registered managers where they need it, but also webinars, and we've had webinars on things like DBS in COVID, and a lot of queries around well-being, people either their own well-being, registered managers needing support with their own well-being, but also how do you support your team, how do you manage remotely, and so a lot of our focus was around that. But we also did quite a lot around technology, as you'd expect, just supporting people to move training online and to reach people online too. we did a lot of work around getting nurses back into social care, so working with all of the partners in local government and the NHS for all of the nurse returners, just to say, quite often social care gets forgotten, but we know that there's a significant number of nurses that work in social care. So when we were getting those nurse returners through, our role was to say, have you thought about returning into social care, because there's a need there as well. But I would also say that one of the first pillars that I talked about that we do that is a real strength is that intelligence in the networks that we have. And so we also used and still use those to say, what are we seeing happening in the sector, and what does that mean that we need to do, what guidance is needed, what are the issues that are coming up on the agenda, and we're hearing a lot, and what are the issues that are becoming less of an issue for people. So that sort of, I suppose, advocacy role. And then I think we've been quite keen to share the really positive stories from social care and all of the stuff that we're seeing that we know happens every day. But I think you need to keep the attention on the things that we need to fix, and I think that's absolutely right. But we don't want the narrative around social care to be one of negativity and failure. So it's getting that balance, and we've had some beautiful stories and creativity that we're sharing and trying to say, actually, in this time, care workers are really being really creative, and it's something that we need to celebrate as well as trying to fix things.
Great. Okay. So thank you for that. It's a bit of context, loads of information that Skills for Care are doing. The best bet is just to get on their website. Mm-hmm. So there we go. You see the back team is on it. Skills for Care website at the bottom there, but you all know that. Now, moving on to some of the questions and things that people are asking. I actually had someone, I don't normally have somebody asking a question beforehand, but they did ask about the WDF, and that's been the main thing on the chat right now. So I will just bring up their question. If I can remember which one it is, 88, there we are. So at a time when care providers need more support than ever, the Department of Health and Social Care decision not to fund the Workforce Development Grant this year basically puts an end to financial support for any CPD and learning for care providers. Disastrous. Can you give us some context around what is the WDF, and can you answer sort of the comments around providers being quite upset about this?
Yeah, I can, and it's I've got some good news actually from today, which I'll share. But for people who don't know, the Workforce Development Fund is a fund to support the sector really in skills development and investing in our teams. We always do an assessment of what's needed throughout the year, and initially what we were hearing was the focus had to be on getting people into the sector and getting them trained, and that there wasn't the same capacity to do the normal WDF training, and so some of that money was put towards providing training for people, and the feedback on that was really, really positive. And since then, what we did last week, and I think this is what's starting some of the questions, was we needed to make sure that we had the balance right between using some of the fund for new recruits into the sector, but also to continue training for people that are still in the sector, so existing staff. And I suppose just to say that nobody cares as much as us. Well, I'm sure the whole sector cares, but it's our primary purpose to value the people who work in social care and to build their skills. And so, and not only that, the Workforce Development Fund is set up in local structures, and those local structures are absolutely essential to Skills for Care. We've built them over many years. We've built those relationships over many years, and so we have a real interest in maintaining that and investing in people in care. So what we did was take a slight pause to say, do we have that balance right, and what is that balance between using some of the WDF for new staff and some on continuing development? And I've had a lot of conversations this week, and my team have been speaking to loads of people this week, and you know, I'm really grateful that people took the time to speak to me and to understand our concerns, and we've gathered all of those and been working with the department to say, you know, we really need to get this balance right. And so just this afternoon, we had a really positive conversation, and we're going to be able to start to disperse and commission the WDF again, because I think we've got a much clearer sense of what that balance should be. You know, I was hearing from one of the providers this week who was kind enough to call me, saying that we're seeing even more demand for some training for existing staff around things like medication, learning disability, autism, dementia, Mental Capacity Act, particularly in the context of COVID. And so there is a real need out there. So I'm absolutely delighted. I would take any amount. I mean, if you give me £100 million, I could tell you where we could spend that on skills development in the sector. And so I suppose that for me, that's just a thank you to people who gathered their thoughts and the potential impacts, fed them in, and we were then able to speak to the department and get that commissioned again. And I I'm not sure what the details going to be, because it's a very last minute decision, but we're working on that to get the detail out to the sector. So hopefully that's helpful.
So that's really hot off the press. So that's going to be a bit of a U-turn then on that, on the back of responses and feedback. So it's absolutely crucial that people, if there is something that's not right, they get in touch and they say it's not right, it needs to change, and quick, fast, we can get it changed. So that's really good to hear that, because I think people were really, really worried. In a sense, though, I think for anybody who's working in social care, that would make sense anyway. I think they would want to make that decision. Do you think that certain decisions that are made need a bit more, co-production maybe is too much at this time, but consultation with the sector before they're brought through?
I think it's really tough. It's always a balance, and one of the things that we always have to ask is it better to get something out quickly and perfect it later, or do you try and perfect it, and then in the meantime people are really struggling to know what to do? And I think that's really tough. And I think if you release what you can with the understanding and I suppose the openness to say this is the start and we need to hear feedback, and if that keeps changing, I think sometimes that can be better, because otherwise what we hear is there's a bit of a vacuum, and what we've got is people doing different things and not really knowing where to start or what the best thing is, or doing nothing. And so for me, I think sometimes it is just better to get something out. But I just think you can't speak to people enough. There's you can't over communicate in times like this, and that has to be two-way, because none of us. So Skills for Care covers all of the social care sector, but within that there are so many there's so many differences, and I think you just don't understand that. So even some of the conversations that I'm having to have as many conversations as I can to understand different contexts, and every day I hear something and I think I didn't know that. That's a new perspective, or it's a new bit of information. So I just think that should never end, I think.
Yeah, that's really positive, and it's good to hear that you're open to that dialogue and that discussion. And I think there definitely has to be, going forward, a way to think about how organisations like yourselves and others do communicate better with the sector, because I think across the piece, which is, like I said before, people don't really understand. I don't think us working in social care realise how little the people at the top really don't understand, especially because most people who are in possession like yourselves haven't done the work or haven't been care providers. So we need to change that. We need to get better understanding.
And I mean just to say, I think I see this quite a lot around, particularly PAs and individual employers. I think that they can be a part of the workforce that's often forgotten and not understood. And we're seeing direct payments plateauing in terms of their take up, and some of that. I was speaking to a colleague last week from TLAP, and some of that is because of a lack of understanding of, or sometimes a fear of employing your own personal assistant. And so I think you're right. There's something that we need to do about the understanding of social care, and I'm really hopeful that coming out of this there'll be a better understanding of social care. I worry that it might be social care just in care homes, and we need to be talking much more about the diversity, and it might be social care in its interaction with health, and we know that that's not the only interaction that's important. This is about people's lives in the community, and I think we can all do more to help people understand that, because I feel like that's one of the reasons that reform is hard, because the public doesn't understand the social care as it is. And when you start to talk about reform, it's quite difficult for them to understand what that reform would look like.
Yeah. So I want to go back to workforce, because obviously that's your forte. That's what Skills for Care is there for. And there was a report that came out by Public Health England a couple of days ago. There was a bit of toing and froing. Is it going to be delayed? Isn't it going to be delayed? But that was about the specific vulnerabilities of certain groups within society. Talked about the obvious, basically, but it did talk about older people over 80. It looked at the disparities between women and men and disability, but also it talks about people from non-white groups, men in particular, Asian men and black men from certain ethnic groups as well. And there was a frustration that there weren't any recommendations. It was just stating the obvious. This is what a Labour politician had to say about it on Newsnight a couple of nights ago.
There are no recommendations in this report, no recommendations about employment, no recommendations about PPE, no recommendations about what you should do on the front line, given that many of these minorities work in the public sector. None at all. That's a small indication of what the government could be doing, but isn't.
So I just wanted to come on to, okay, the government isn't, maybe it's behind, maybe it's coming, I don't know, but these are real issues for us now. I know within the care sector, we think we have those staff. Your own statistics from Skills for Care, you do a state of care annually, show that there are a disproportionate amount of non-white groups that work in social care compared to how many people are in the population. So is Skills for Care going to provide some kind of guidance on how care organisations, managers can protect those staff groups?
Yeah. I mean, I think this is really key. It was something that I, when I first started just getting a sense of all of our reporting, and so yes, 21% of the overall adult social care workforce is from a Black and minority ethnic background, and that masks some real regional variation. So in London, that's 67%, and so that's just it's a massive impact, I think. And one of the things that we've been working on. So there's an NHS risk assessment tool looking at the different impacts on different groups from COVID, and giving some advice around what can be done to risk assess that. And we sit on the task and finish group for workforce with the department, along with a lot of the sector bodies, and we've been working on what that guidance needs to be for social care. And I think it's a combination of clarity on what the evidence is saying and who the most risk groups are, but also what are the choices and the conversations that you can have as an employer, because it's quite difficult to say it's always going to be this option or this option, because quite often it needs to be a conversation between the individual and their manager, but the manager needs to know what are the options available to them. And that might be additional PPE, it might be prioritizing testing, depending on the size of the provider, it might be redeployment. So we've been working on that to make it, I suppose, to make it work for social care. And that goes back to my point earlier around I think there's something around then that more practical support. And one of the things that came up actually today on one of our webinars with registered managers is, can we have a webinar for managers to talk about how we have what conversations we need to have with more at-risk members of our teams, and what are the choices that we have and how we actually do that. And so we're looking at setting up a webinar for some people to come and give some advice on that, and I can send that around when it's ready, and we can get that out so people can attend it.
Great. I think that's brilliant that you're having those discussions, and I think with everything, time is of the essence. So I know that you and your team will be working flat out. So it would be great to have those discussions, and even in your planning to have those discussions, whether it's on Twitter or through your networks. Yeah. What support do you need right now in order to support the groups of staff that you have that are at high risk? I just want to come on to just generally with workforce now. Again, it's another clip. I don't know who we think we are. We're there showing all these clips all the time. But it did really touch my heart. Again, it was from last night's news night, and it does explain about a care worker and the sacrifices that she'd had to go through. She stopped seeing her little boy because she was working in a home that had COVID outbreak and deaths, and she chose to make that decision.
Marcina, now herself at risk of COVID-19, had to take the decision she'd been dreading: to move her son in with her parents. When we met, they'd been living apart for a month.
I've had wobbles when I'm at home, because it's those times that affect me more, because I have nobody to take care of. Miss those snuggles at night. Yeah, I've had the thought of, why am I doing this? And then I'll get a text from Lisa or a phone call, and I think, yeah, this is why I'm doing this. This is what it's about, and we'll get through this.
I just wanted to find out from you, do you think that we are supporting, rewarding, giving career options enough for our care workers, considering what they do despite COVID and now because of COVID?
No, I think we, when I look to the future, I just think it's got to be better than it was before. And if nothing else comes out of this, then we've got to build on the fact that people understand that social care is a really skilled role, but not just skilled, really valuable. Our communities couldn't survive without people who work in social care, and I really hope that we manage to then build. I have seen this hashtag Build Back Better, and that just resonates with me. And I think that does mean we need to recognise people. We've got to fix pay. Martin said it himself, stealing all my lines. But we've got to invest in skills and development, and we've got to really value and appreciate social care. And for us, I think something we can do in the sector is be clear what our distinct value is as separate from health, and really own that, because I feel like we need to be saying, actually, social care is so valuable, and you've seen that now, and we need to build on that, because we just can't. I don't think we can go back.
Some people would say Skills for Care always had the brief on workforce, and maybe Skills for Care should have done more, so that either raising the profile, either sorting out the training. Is it that a fair criticism, or is it difficult because of the funding that Skills for Care? Because there is a connection with Skills for Care and the Department of Health and Social Care. It's not a totally independent charity. It used to be, back in the 20 years ago or 10 years ago, whatever it was, one of the Quangos, isn't it? So should it have done more? Could it do more in the future?
I think some of it depends on the context and the role. So I think we definitely can and will do more in the future. So I think we have a really clear sense of what some of that looks like. And you know, I've just seen a comment popping up there. We need to support skills development beyond accredited qualifications, and I think that's right. I think that's absolutely right. So I mean, I see skills for care as being absolutely vital in this conversation going forward. You know, that we really do deeply understand the workforce, and we've got to make this better, I think.
Okay, that's good, and it's a good recognition that, you know, there more needs to be done going forward. I think we're coming up to the top of the hour now. I think someone said we're not clapping anymore for carers, but you know, some people might be, so we probably should finish pretty much on time. But are there any other comments or anything else you want to tell people who might be watching?
Just, I suppose, to use us. You know, we particularly thinking about our insights and our data. If we know what's happening in the sector, that we can really use that to influence. So I would say really do access and use our resources, but also tell us what you need that we're not doing. And particularly because I'm new, I'm really keen to hear, you know, are there new things that we could be doing and supporting with. You know, we've got a lot of local teams who are really well networked, and so, you know, do just reach out and let us know what else we could be doing that we're not.
Yeah, and you know, I've got a comment here. You know, NHS colleagues have huge learning and development budgets, so we need to see more parity. And I know I went to a conference at the King's Fund a couple of years ago, and someone had a slide up, and they said, you know, this is the amount of funding that the NHS gets for training its staff, and you know, he did it in a graphic and it filled a square, and then a little dot in that square was the amount of funding that social care gets to train and support its staff. So there's a huge changes that need to happen, and it's good that we've got yourself Skills for Care all ears, and again, obviously just feeding back because you are listening and supporting the sector as much as possible. Okay, well, thank you so much for coming on, Oona, and I'm sure in a few months' time, maybe when things are different or better or change, we might have you back again if you're free.
Brilliant.
Thank you so much. Take care.
You.
So that was it. We made it. We managed to make it just about in an hour. We covered a lot of ground. I really hope you found it helpful. There were some more comments and things that I really wanted to pop up, but it was just difficult to get through everything. We really jam-packed it. If you ever want to watch back, you can do. The link you're using right now, it's live. It will carry on. It will stay there even after I've finished going live. So you can absolutely just watch back. You can share this link with your colleagues. The announcement about the WDF is fantastic. Share that. Get on your networks. Stop the anxiety that people have about that, because I think that's a great announcement. Really reactive as well. So yes, please do use those resources, and like Oona said, get in touch with Skills for Care. And if you're members of Care England, of course, they're all ears as well. And they will be carrying your views and your thoughts and suggestions to the Department of Health and Social Care. So there's more up and down flow of information suggestions than we've ever had. Maybe we won't ever have this again. I hope we will. I hope it will continue and increase. But that is it. For us, just to let you know, we're moving on. We've had great CEOs, great leaders. We've had a carer. We had a parent whose daughter has autism last week. Now I'm moving to lived experience. So next week we will be having Isaac, and he's someone who's got lived experience of disability, of mental disability. He'll be coming on and talking to us about his experience, but he's also a massive lobbyist person who goes and talks about his experience and tries to change policy. And he's also really inspirational. I'm so looking forward to having him. I wanted someone with lived experience on this since we started. That's really exciting. So please do engage with us. Please subscribe and all the stuff that I've been mentioning before, because we really just need to get more listeners, get more people engaging and hearing what really is behind the headlines in social care. So thank you all for your support. Thank you for listening, engaging in the chat. I've really enjoyed that, and I hope you've enjoyed it too. So take care, everyone. Stay safe, and we'll see you next week.